Another audio check. Sylvia, can you hear me okay before I get started? Welcome everyone. Today for this webinar you are all on. I know we had a lot of interest in this topic. It is definitely a critical topic and we're happy that you think so as well. And we have a lot of information that we want to share with you, and Patricia and I will be a tag team for this webinar, and so I'll be presenting some slides and she will as well. And we're going to be asking a couple of questions, and we're going to have some poll and some chat discussion. So I'd like to just thank you in advance for your participation in that. We want to make this a very very warm and friendly presentation. We want to learn from each other, while Patricia and I will be sharing a lot of different strategies on how to start thinking about employee engagement and staff satisfaction. We also want to have an opportunity to learn from what others are doing. I'm sure that you all are implementing some great strategies, and we're going to be imparting some as well with you here during this presentation. So let's just go ahead and get started here. Some of the things we're going to be covering is the importance of talking about this topic. Why are we talking about staff satisfaction and engagement, and why it's important in the workplace? We're going to talk about some strategies, and I want you to start thinking about how we can create a more strategic plan or initiative to do that. We're going to be talking about 3 key factors to think about as you move forward in these efforts. And lastly, we're going to talk about how do we measure it? How do we know that we are ensuring that our staff are satisfied? How do we collect information? How do we interpret that information? But more importantly, how do we ensure that we put that back into practice and that we're actually seeing change in our organizational system? So again, a lot to cover for this presentation, but quickly, a little bit about NCFH. I know you know about it since you're on this webinar and you're receiving our e-digest. I just encourage you to keep getting that information and looking closely at our training opportunities. We have more to come. We have a few by the end of the year, and we have more starting next year. So we hope that you continue to participate with us on these various training opportunities. So again, why are we talking about employee engagement and job satisfaction? And I'm going to be using these terms a little bit interchangeably, but they are quite different. And regardless if we think about employee engagement or satisfaction, they're both critical, and we need to have a plan to think about it. And my hope by the end of the webinar is that we start thinking a little bit, or start shifting our thinking to employee engagement. But this is a critical topic. It's pretty straightforward if you read what is on my slide. In healthcare, we have a huge responsibility, a significant responsibility, because we're providing quality care. We want to provide excellent care to the patients we serve. But how do we do that? We have to do that, obviously, through our staff and our employees. Our employees are the greatest asset of our organization, and we're only going to be great if we have great staff. So it's really how we prepare our staff is critical in order for us to provide the best care possible. So as we think about these concepts, as I just mentioned, I want us to think about employee engagement. There's a difference between the two. So regardless of what you're doing, great, I'm glad you're thinking about this. You're doing some things. I know that many health centers now are doing a lot around employee satisfaction. You might be doing a survey, or you might have an employee suggestion box. Those are great things to have, okay? So when we think about satisfaction, we kind of think about, well, are staff doing the job? You know, what do they excel at, and what makes them successful? And it's really about their own commitment. I'm committed to our mission, therefore I'm going to do my job very well, and I'm going to be very satisfied in that. But as we think about employee engagement, which is what we want to challenge you to do, it's really about when an employee is engaged, they're really going above and beyond. Okay, they're not just doing their job, but they're always thinking critically about how can I make our organization better? It's not just about me, but I'm really invested in our systems and the strategies we have in place, and we want to be successful. So it's about mutual commitment. So those are, I just wanted to set the stage for the differences in them. And while I may be talking about both of them interchangeably, again, I want us to think about employee engagement. So as we move forward, one of the critical things we need to think about, it's not just about, you know, it's a feel-good initiative. I'm gonna put the employee box out, and we're gonna get these suggestions. You know, we might do a celebration luncheon or an awards luncheon or an employee of the month recognition. That's great, and those are great strategies. But I want us to think about today, how can we have a plan? How can we be more strategic? Just like health centers put together a 3-year or a 5-year strategic plan, I want us to think about planning the same way for an employee initiative. So hopefully everyone that has a strategic plan also has a goal or a strategic direction around workforce development or staff engagement. And I see a lot of health centers that do. And within that goal, they have a variety of strategies. If you don't have that, I encourage you to think about it in that way. How can we develop a plan? So for those of you in the audience who have quality improvement committees or processes that you're already looking at patient satisfaction, for example, because I know all health centers are looking at patient satisfaction and have to collect that data and have to act on that information. Likewise with employee satisfaction and engagement, what is our plan? What are our goals? You know, what are some of those objectives? And what are some of those outcomes that we want to see? And I'll talk a little bit more about that later when I talk about measuring that. So when we think about in staff satisfaction, we can think about it in a lot of different companies and organizations and different businesses. It's a little bit different in a health center environment. We recognize there are a lot of challenges. Health center staff are faced with, you know, a lot of demands and a lot of tasks, and they're having to address patient needs, but at the same time being part of a workplace where you have to rely on your team, and that can be very, very challenging. So we recognize that it is very different. And the more satisfied our employees are, then guess what? The quality of care is going to be just as good or even better. So there's a direct correlation there. If we have unsatisfied healthcare employees, then that's definitely going to negatively affect the quality of care that you provide. So we know there are some roadblocks. There can be some roadblocks that prevent leadership from embracing this process. Sometimes as leaders, we think, you know what, I haven't really heard anything. I haven't really heard any problems. Everything seems to be going great. We don't need to do any type of staff satisfaction survey. You know, if there was a problem, I would know about it, right? As a leader, we might think that. And so, or we might have the mindset of, you know, we're here about patient care. All of our focus is going to be on the patient. There's really no time for anything else. And so we have to recognize that all organizations will have issues. Not every organization is perfect. We're going to be talking about some of those challenges or factors that contribute to why staff are satisfied or dissatisfied. We really need to understand, why are our staff dissatisfied if they are? How do we collect that information? How do we understand it? How do we engage staff in the problem-solving process? And then, of course, implement. So we have to think about, it has to matter to all of us. It has to matter to all leaders, and we want to make sure that it is something that is infiltrated throughout the organization. So satisfaction is dissatisfaction. This is information I really wanted to share with you that has been gathered from a variety of surveys that have been done specifically with health centers. So you ask health center staff, why do you like your job? Why are you satisfied? The number one reason people say why they're satisfied in community health centers is because of the mission and serving the vulnerable populations. And I always like to acknowledge health center staff and the work that you do, because I tell you what, health centers provide excellent care and different care that I may receive from my private provider. And so you are juggling a lot of things, and you have a lot of requirements and compliance things that you have to follow, which adds another layer of complexity, but it takes special, unique people and passionate people that come to the community health center movement. So thank you all for the work you do in community health centers, because I know it's a tough job, and but it's also very rewarding. And that's the number one reason why people are satisfied, is because they believe in the mission. So think about this as leaders, as you think about your planning and making sure it's part of your culture. How do we share that and get people excited around the mission and the vision? And again, likewise, the way you have a vision for your health center, and that's breaking down all barriers, or addressing all barriers to care. What is our vision for staff? You know, so having that mission and vision for our organization, I want you to think about having that same vision for staff. Another reason people are satisfied is because of the sense of teamwork. You know, health centers work in teams quite a bit. And so that gives them that sense of pride of working there and the enjoyment that they seek. But there's also some dissatisfaction. And this is the number one thing we see in health centers. And you know this, is that there's a lot of expectations on the work. You know, a lot to do. Sometimes there's a lack of efficiency in how we do it. There may not be a lot of clarity. There may be issues between a manager and supervisor, or manager and staff rather. And that's the number one reason why people leave, is because they feel like their manager or supervisor is not really listening to the issue. Lack of effective communication, very, very key. That's also a huge problem in organizations, and we'll talk more about that in a little bit. Lack of appreciation. And then last on the list is compensation. And believe it or not, while it's important to have a competitive pay and benefits, that is not the number one reason why people stay. And so, you know, you can give people more money, but if the work performance doesn't change, well, then there's still a challenge there. So I wanted to point that out. Here are just some top 10 drivers. This is from the National Association of Community Health Centers and the work that they have done around staff satisfaction. These are just all very critical, and I mentioned some already. It's really important that people understand their job, what they do, all the ins and outs of the work that they have to do, communication, shared workload. Again, mission is on here. Staff satisfaction with supervisors. So what I'd like to just say about that is because staff are our greatest asset, the manager and supervisor relationship becomes very key. Are we preparing our managers and supervisors with the right set of skills to be able to have to be there for their staff, support their staff, provide them with the guidance that they need, the coaching and the mentoring, and do they have effective communication skills to do that? We'll talk more about that in a little bit, but I'm going to stop now because I want to get a sense from you all here in the room or in the audience around what are you doing? Do you have a plan? Do you have a process for employee engagement or satisfaction? So we're going to start a poll here next. Sylvia's going to put it up. First question. And we're going to give you a few minutes, not a few minutes, about 30 seconds to do so. You would be, hopefully you can see it and able to respond to it. And if you do not have a plan, that is okay, or if you're unsure about it, that is okay. We just want to get a feel from you on where you're at in the process. Okay, well, the results are in. We have a pretty mixed group here. We have about 34% of you who said that you do have some sort of plan in place. 36% said no, and 30% are unsure, okay? So a mixed collection here of responses. For those of you who do have a plan, that's great. I want to learn a little bit more about that later on what are some elements of the plan. Those of you who don't, we hope that by the end of the session, you can start integrating some of these thoughts and strategies that we'll share with you. And those who are unsure, we hope you go back and ask, because perhaps your performance performance improvement committees, risk management committees might be looking at this. Your HR departments may be looking at this, and you may not know. But that's really critical that if you don't know what's going on, then it's going to help us think about what can we do in our organization and culture to start changing that, because we hope that everyone in the health center would know what initiatives are going on that supports the whole team. So thank you for sharing that. Let's get back here. Here's the discussion I want to now ask you, and if you can use your chat feature. So for those of you who said yes, which again were about 34, 36% of you, could you tell me a little bit about what's in your plan? What is kind of one of your highlights that you're most proud of in your plan? And I'm going to call out here I'm going to read some of the responses. I'm looking at the chat feature here. So if you can just share with us what are some elements of your plan, that would be great. Again, I think there were about 30% of you who said you had something. Okay, I don't see any popping up here at the moment. Oh, here's a couple responses here. Employee one-on-one meetings. That's one of the elements. That's great. We'll talk more about that in a little bit. That's very important. Anybody else have some sort of process for doing it here? I like this. Someone talked about, of course, all staff meetings. All staff meetings is a great way to make sure everyone is on board with maybe your initiatives. Best People, Best Workplace Committee, who are tasked with this initiative. That's great. I've never heard of that. That's wonderful. Very creative. Best People, Best Workplace. So a lot of great ideas. I encourage you to look at the chat feature. I won't be able to address them all, but someone talked about how they have a fun committee, employee survey, suggestion boxes. That's great. Monthly rounding. You have a bright idea. Electronic communication board. So this tells me that you all have ways that you're doing that. Again, what's key is for health centers that may have multiple sites, which I know a lot of you do. You might have 3, 4, up to 10 or 15 health center sites. It's key that every site, though, is doing something around employee engagement. And so it needs to be consistent across the board. So great ideas. Thank you for sharing that. Again, I encourage you to look at what was posted, because there's some great things here, and I will point some out as we get further into the discussion. Provider focus groups came in. That's great. A lot of employee rounding. Employee engagement is a pillar goal and strategic plan. That's great. That's exactly what I was talking about earlier, in that it should be part of your initiative. So thank you again for sharing that. And we're going to go ahead and move forward. I'm going to now turn this over to Patricia now, who's going to be walking us through some key factors to think about as you put your plan together. Patricia?
Okay. So as Alicia shared about the importance of staff satisfaction and how it impacts our work and providing care to our patients, how do we increase staff satisfaction? Well, based on studies and surveys, there are 3 critical factors. The first one is leadership support. Second is culture of open and frequent communication. And the third is employee empowerment and initiative. So let's begin with factor 1, leadership support. Research and many surveys tell us that there's a direct connection between staff engagement and leadership. So if we look at this from a top-down approach, your leaders, they're your drivers. They set the stage and are the first step in providing an environment that leads to engaged employees. But, you know, they're critical in creating this culture so that employees can thrive and be engaged. They want to feel valued and trusted. But how do they do this? This slide points out a few ideas, and I'll just touch on a couple of them. As Alicia mentioned, a lot of the employees in health centers are already passionate about what they're doing. So these ideas, if you implement them, they can build on that passion and, you know, kind of create and make that a stronger platform for that engagement culture. Alicia also mentioned that employees are our greatest asset. So you want to do what you can to help them to feel trusted and valued. And so we'll touch a little bit more on that. One of the most important things is having a strong vision. And we're talking about a vision of what employee engagement or empowerment is. What does it look like? You want to communicate this. You want to make sure that everybody understands it. For example, if you're going to add a new program, for example, maybe you want to add a new mobile van. Are you going to reach out to the outreach staff and the staff that deals with this issue on a daily basis to get feedback on what you can improve on? Or as leaders, are you just going to make that decision among yourselves? So that's just something to consider. You also want to think about how are you interacting with your employees as supervisors. Leaders want to interact with employees. You want to treat them equally. You want to get to know them. You know, research states that, and I think Alicia mentioned this, employees leave organizations because of direct supervisors if that relationship is weak or strong. So engagement of employees is definitely tied to the leadership of their direct supervisor. You want to make sure that information is shared and keep in mind that employees perceive equity among each other, and you want to consider how you're demonstrating that you care for them as individuals. Another key thing here is employee development. You want to help them to improve and develop new skills. You want to coach them, possibly just help them design a growth plan. One thing that we hear consistently is that health centers are short-staffed many times. So consider cross-training to fill in some of the gaps when needed. You know, and consider also that many times when tasks are assigned to someone, they often fail because they don't know what the expectations of that role are, or they don't have the tools to complete the task. So you want to make sure that, you know, cross-train, make sure that they know what is expected and how to do the job. Also keep in mind that employees, they want an opportunity to develop and to grow professionally. So give them those opportunities to grow in the job within the organization. Alicia also mentioned the importance of a team environment. Everybody wants to feel like they belong, that they're part of a community, and you can do this within your health centers as well. So all of these ideas help to build a culture of trust. So keep in mind, are we walking the walk? Are we doing what we said we're going to do? Employees need to trust the leaders and trust each other. And then last, you want to make sure, I think we've mentioned a couple of times, the reward and recognition early on. It was part of the surveys that were received from health centers, that they want to be recognized. So how are you doing that? And are you doing it in a consistent manner? A couple of ideas are, you know, a quick email, a kudos email, letting them know that you appreciated them going the extra mile. Send a thank you note, a quick little thank you note for something that they did. It helps them to feel validated and acknowledged and valued, which leads to engagement. And overall, it positively affects the employee, the patient, and the bottom line of the organization. So factor 2, open and frequent communications. One of the most important things that an organization can do is to foster engagement is to have an open and frequent communication plan. we probably have heard before that the #1 problem within any organization is not having enough communication, or lack, just not clear communication. And although if we think about it, we communicate on a daily basis. It's pretty basic. However, it can be complex when you consider the different ways that we communicate. So many times if you stop and ask, where do we fail as a team or as an organization, it will point directly to a breakdown in communication, or lack of. So having a lack of communication often leads to fear and anxiety, which you want to avoid. One of the challenges, or there are a few challenges, but they're due to the dynamics of the communication, they're due to the communication styles, because we all communicate differently, body language. So we need to consider, how do we create an infrastructure for open communication? Here are some ideas. Some examples to implement and support this factor. You want to have a transparent workplace. You want to be approachable so that your employees can feel comfortable enough to come to you with issues or ideas. You want to make sure that if you have some changes or decisions to be made, that you openly communicate those, you clarify them. Ask, are you seeing closed doors, whispering? Those kind of actions lead to anxiety and fear, which again, you want to stay away from. Clear communication channels are key. Again, you want to, by being approachable, by being open and accessible, your staff is able to provide feedback, and you can reinforce strengths. You also want to, if you're providing feedback to them, do so promptly. And preferably communicate in person as opposed to email, because we all know email can oftentimes get misunderstood. Are you having regular check-ins? Are your meetings, do they have a plan? Do you have an agenda? You don't want to just show up in a meeting and just, not have a purpose. So ensure that there's a purpose, communicate that so everyone can come to the meeting and be prepared to share. Another very important strategy is that of communication guidelines. We want to provide, having a communication guidelines helps to provide or set the tone for how an organization is to communicate. You want to have a structure. It helps everybody to be accountable, because you know that it's safe and it's expected to communicate in this manner. It's just, and you also want to be consistent with this process and how to fulfill that. So we often hear that there's a big disconnect between leaders and the rest of the team. So we also hear it would be nice if leaders came by from time to time, especially in larger organizations where it's more difficult to do those things, but it lets the employees know that they matter, that you took the time to go and stop in and visit and see how they're doing. So basically this factor, it all has to do with keeping the staff up to date, letting them know what's going on and in the know, so that there are no surprises. Anything that needs to be communicated, they heard from you as opposed to the grapevine. So all of that helps to create a stronger team. The third factor, which is employee empowerment and initiative. What do we mean by that? Well, we want everyone to feel empowered, to make decisions, to offer suggestions for improvement, and to be committed to the organization. And we can do this, we need to do this on an ongoing process by providing tools, training, room for growth. You want them to be able to perform at an above and beyond level, and you do that by helping them be prepared. Also, another benefit from having empowered employees is that they feel they know their job, they know what's expected, they know that they can make, if a decision needs to be made, they can do so. It speeds up the processes that are often involved instead of, someone has to wait for an answer from someone else. If they're empowered to make a decision on something or make a call, then it helps the organization as a whole. Some other ways that you can empower staff, it's important that you empower all employees, not just managers, not just leaders. You want everybody. And some of the ways to go about this are to make sure that they understand the organization's vision, their role, and more importantly, how their role fits into the big picture. Again, encourage feedback, and when they do provide feedback, listen to them, to what they have to say, their ideas, suggestions, and then let them know how you're going to use that information in the future. It reinforces that their opinions are valued. Also, keeping those lines of communication open are critical. Keep the staff involved. You want to make sure that you not only establish connections on kind of a team level, but personal levels too. Get to know them and be able to recognize each other is important. You want to stress that collaboration is key so that you can build that team, that community of team and help and belonging, which is very important in having staff be satisfied and help and feel connected. So again, inspiring, providing good feedback, and more importantly, being a good role model yourself so that they're watching you. And so learning from you, you're able to enhance their feelings of confidence and help them to find meaning in their work.
Okay, so I want to pause here a little bit because I'm seeing some great ideas that are coming into the chat as Patricia was talking, and I wanted to just address a couple of things. I know that Patricia talked a little bit about how do we create the culture. That's key, and there were some ideas about the role of the leader, which is critical. You all as leaders are going to drive that, right? But we have to create the culture. And so what does that mean? As I mentioned earlier, you want people to walk into the health center and can actually feel that this is an empowering place to be. And there's a lot of things to think about that Patricia talked about. What are some of the communications, ways we're going to communicate? How do we build that culture of trust? And if I can say one thing about all of these factors, I want you to really think about the communication guidelines that she mentioned. Just like health centers have customer service guidelines, or we have a code of ethics that we're going to stand by as you do customer service, I want you to think about having guidelines for your staff. I've worked with a lot of health centers and going through a very strategic process of identifying communication barriers, as Patricia mentioned. That is like the #1 key problem in any organization. So I've worked with health centers to really look at how do we identify those barriers, what is the information they feel that they're not receiving, and how do they expect to get it. So as you create that culture, and this is like the top down, while we want to have bottom up and we want everybody engaged, leaders have to drive this. And you need to drive the development of these guidelines or the framework that's going to build that culture. So I challenge you to think about how do we communicate information that is critical around the organization. Say you're going to implement a new program and people have heard it through the grapevine, but they haven't necessarily heard it from their manager. How do we communicate that? How do we communicate, giving kudos to staff? How do we communicate changes in their job descriptions? So there's a lot of layers and complexity in communication. And so think about what information you're going to communicate and in what method you're going to communicate it. If you know that you have teams that are struggling with each other, there's problems within a team, you necessarily don't want to use an email to kind of resolve that communication problem because things can get misinterpreted. So as an organization, how are you going to decide how you're going to communicate that? And I bring this up because you want to have an infrastructure for doing that, and you want all staff to buy into those guidelines, and you want to ensure accountability. We want to create a culture where people feel empowered to say, you know what, this is not in our communication guidelines. I feel like we need to probably have a one-on-one. This isn't appropriate for us to be talking about in a group setting. And so again, that creates that culture of trust that Patricia was describing. Now, someone in the chat box said to me about, can we use newsletters? Will newsletters help in that factor too, which we were talking about, communication? Absolutely. Those are the things that you need to think about. But newsletters may not be the only way to share all kinds of information. You have to think about the type of information you want to communicate. And I wanted to focus on this because that is, again, the #1 reason why people leave an organization, because, well, I didn't know that, or I heard it through the grapevine, and it's not always the right information. And that is a direct correlation to employee empowerment and motivation. Okay, so I wanted to point that out. So yes, newsletters would be great. That is a quality of information sharing. And then there may be things that should come from the CEO or leaders, critical information that's going to impact the way we do business. How is that going to be communicated to everyone in the organization? Because information is power. And if you want people to be invested and be part of the mission and moving the vision forward, it starts with information. So I just wanted to point some of those things out. And yes, we do have a sample communication guidelines document that we can share. I will make sure that you get that. And so people just talked about a lot of meetings. Another thing I wanted to bring up about meetings, I'm glad you're having meetings, and those are effective way of communicating information. But as Patricia mentioned, we have to have a plan to do it. As basic as it sounds, I'm sure many of you in the audience have gone to many meetings, and you go spend an hour there and you're like, what happened? What did we resolve? What was the goal? And if there's one strategy you can do, I would encourage you to implement a method to do that, because, and I'm going to speak about the ORD later, but it's objective, reflective, interpretive, and decision. That is a meeting method, and I'll be happy to share that with you. I think it is a fantastic method, and it will help you as leaders and supervisors and whoever is running meetings to follow a plan. Because we talked about how critical it is to get employee feedback and be part of problem solving. Well, guess what? If you follow the ORD during your meetings, that's going to be a way that staff is going to start seeing, oh my gosh, I shared my opinion, and now we're going to decision, and now you're going to start seeing the action. While it sounds very basic, that is one element that you all can do that people are going to start seeing, oh, my voice was heard, and I'm actually seeing the change. So it's those little things that are going to build up to greater things. So I just wanted to mention some of those things that are coming through, and thank you for sharing that. And one-on-one meetings and group meetings are very effective, but let's have a plan to do that. So let's get back here to motivation.
All right. So we talked about empowering staff. Well, we also need to keep in mind and understand motivation. You know, they go hand in hand. The heart of motivation is when we give people what they really want most from their work. So what drives your staff? You know, everybody is different. We don't know if we don't ask. So you can also consider, you know, many would say that money is a driver, and for some people it is, but it's not always the case. As Alicia pointed out earlier during the surveys, they're already passionate, and they gave us a lot of what they want. They want to have a sense of belonging. They want to feel trusted, valued. So there's different motivators. The one thing that you need to keep in mind is that you cannot motivate another person. You can only create the environment in which people become self-motivated. So all people are motivated by different things, different reasons. The challenge is not the motivation. The challenge is leadership. And that's what, you know, we need to keep in mind, that leadership can occur at all different levels. Okay. So we have another chat question. What are 1 or 2 realistic ideas that you can put in place now to enhance staff engagement efforts at your organization? You can just type in your feedback in the chat box so we can read a couple of those.
Any ideas on what you can put in place now? I know some of you mentioned earlier already some ideas that you're doing around meetings and perhaps some newsletters, but we do see some that are coming in, roll out of a 360, which I'm assuming that's the 360 employee feedback.
Implement employee engagement survey next year. Perfect. State of the Union email communications. Very good. Meaningful icebreakers that are relevant to the meeting topic. Yes. Perfect. And, you know,
and those State of the Union emails, if you will, that goes part to the communication guidelines I spoke to earlier. That's a great method of delivering critical things that are coming from leadership. That's a great way to do it. And so again, but we got to be consistent, and we have to do it and be very specific about what those State of the Union emails will include. Great, thanks for sharing those. Patient satisfaction focus groups. That's a very good way, because you'll know how employees are doing based on the responses that they're getting from their patients. So a lot of great ideas. Thanks for.
Thank you. Great. Those are some great ideas. Thank you very much. Okay.
Okay.
I think Alicia's next up.
Thank you, Patricia. All right. Now we're going to talk a little bit about some of the strategies for improving staff satisfaction. And so you've already mentioned some of them. And we know what the benefits are. We need to do this for a lot of reasons that Patricia and I already said. Is, you know, our staff are critical. They're the main asset of an organization. So we want to be able to see these positive changes. And so the better the infrastructure we have, and that culture that we talked about that you have, we would be seeing improvement if we're doing it in a consistent way, and that there's a structure for doing that. So as you think about a plan, I'm just going to share this model. I hope you find it of benefit. I know that many organizations that have put together a planning process have used this as a model. Think about what drivers, what are those critical elements in your organization that you want to be looking at or thinking about. Some of these things might be in a survey, others just might be ideas you think about for strategic planning. But, you know, what gives people purpose, how people like to participate. You want to look at the people. You want to look at what they call it peace, which is work-life balance and wellness. You know, how do you integrate that into your workplace and your property, and how people participate in development of those resources and technology, and then the outcomes you hope to receive. So of course, in any plan, you want to see outcomes. So I'll go back to the plan that we alluded to earlier that you should have, like a strategic plan. You know, what are 3 things you can do in 1 year to improve employee or to build employee engagement? So if you're only doing satisfaction right now, and what I mean by that is an annual survey and doing analysis, now what can we do next year? Maybe it's 2 or 3 things that you mentioned here. For example, a 360. That would be a great goal to have for next year, and what are those outcomes that you hope to see? So just like any evaluation, you also want to evaluate employee engagement. So part of the infrastructure that we talked about, not only having those guidelines in place, but also policies and procedures. You know, we have to have policies and procedures for all the things that we do. And so staff that you're supervising, perhaps, what are the procedures they have to do their job? What are those daily things they have to do? Likewise, when we look at patient satisfaction, you should have a policy and procedure, and that's usually done by quality improvement or your quality assurance program. And likewise with staff satisfaction, or employee satisfaction, you need to have a policy and a procedure for doing so. Okay, how often you're going to do it, and perhaps there's other activities that you're going to have that support that. So we have to have the infrastructure in place. Other things to think about. I know that you all do annual performance assessments. If there was any way to shift towards a quarterly assessment, that's a great strategy, because, you know, you can't wait every year to find out why perhaps why staff are unhappy with their job, or maybe they're struggling. And if you haven't built that manager-employee relationship, then there's going to be struggles. So I know many organizations that do quarterly performance assessment where there's a negotiation of what are some of the behaviors that you want to see change, or things that they want to do. Perhaps they want to go above and beyond and do something that you didn't even think about. So doing those quarterly assessments is a really key strategy, and especially if you want to build that culture that Patricia mentioned earlier, that's one way to do that. Performance goals. We talked about incentives. We hear a lot of staff, health centers that have a lot of different ways of incentivizing employees that do a great job through Employee of the Month programs or a luncheon. Think about how you're going to do that. And someone on the chat asked us if folks have a budget. So if you wouldn't mind answering that. There was a question, do people who are doing all these great things, do you have a budget to do that? I'm curious about that. There are a lot of things you can do that don't require a budget that we've talked about. I mean, coaching and mentoring, we talked about that, and doing cross-training, you know, that's something that we can do within our organization. But if you're doing things like incentives, and of course that costs money, you know, do you have a budget to do that? Those are very important discussions that you need to be having at the leadership level. As you do strategic planning, we should have resources built into our plan to do that. Now, again, we have to be realistic. You might not do everything in 1 year, but what is that one critical thing that you can do, and can you budget for that? And then every year, because you want staff to see that there are things that are happening. As Patricia mentioned earlier, it's something that you have to think about all the time. It's a process. It's not one time you do it and then you don't. So if any of you, while I keep moving forward, because I want to be mindful of time, if you can answer the question, if you can answer that question, that would be great. Do you in the audience have a budget to do employee engagement or satisfaction? That would be very helpful to know. Now, one of the things that we know is that staff satisfaction is like a thermometer, that we check the pulse, you know, we check the temperature of how we're doing. If you're not doing them, now's the time to do it. I know that this is very important. It's very critical to the success of our organization. So I want to ask you, if we can pull up this poll here next, I'm curious, how often do you all administer staff satisfaction or staff engagement surveys? If you can take a couple of seconds to answer that, we'd appreciate it. So the poll has started now. We'll give you some time. Okay, thank you for answering that. It looks again a little mixed response here. 50% of you say you do it every year. Every 2 years, 25% of you said that. 8% said you don't. Every 6 months, 5% of you said that's when it happens, and 13% are unsure. So we have, again, a mixed response. So we hope that you think about doing it at least annually would be key to make sure that you're getting that feedback. That feedback is important. And as Patricia mentioned a while ago, you know, we need to know what motivates staff. Everyone is different. You know, why staff want to stay, what they feel about their job. Unless we ask, we will not know. And so it's important that we do that as often as we can. Now, for those of you, and I'll share some resources in a little bit. I know a lot of health centers do surveys on their own, and while that's great, think about the fact that you can do a survey monkey and then you can analyze those results, but how do you interpret it, an analysis of it? There's a skill in doing that, and how you want to then convey that back to staff and the action is what's key and where we mostly fail. Okay, so you do the staff satisfaction, and then 2 years pass, and then you hear people say, well, what happened to the results of the last staff satisfaction? And I don't really see things changing. So if you are going to do your own staff satisfaction survey, start small, but think about the complexities of doing that survey. And more importantly, how you share the results is going to be key. And I wanted to share, there was a particular health center that I worked with that this was their strategy, and it worked really well. After the survey was administered and the results were analyzed, they started doing health center site focus groups, like there were conversations, and they shared the results. They said, thank you for responding, here are the results, and together they verified and identified what were the 2 or 3 things that they felt were most critical. And they had to tell them up front, you know, we have a small budget, or we have a very little, you know, or no budget, so we're going to try to do what we can. Again, that goes to that transparent workplace that we talked about earlier. We have to tell people what we can do realistically. The more information you tell them, then the more they know, and they feel like, okay, they get it. But it's what we don't tell them is where we then start speculating. So share those results and then create those action plans, and they should be part of that action planning process. I think that this has been a very effective strategy for that health center, and that health center has seen a lot of change because the staff is what's driving those employee factors that were critical to the success of that organization. So just some food for thought about that. Planning and improvement, here's that model I referenced earlier. Someone asked me for the ORD. It's right here. It's very similar to what you see in clinical care, the PDSA model. These are things you can do. Once you have survey results, how then can we share it, and then how can we find a way to get to decision? Objective, reflective, interpretive, and decision, or act, plan, study, and do. These are 2 models. Don't worry, I will send you information about them, and these are great for meetings, okay? So if you're going to do some type of focus group after your survey analysis, this would be the way to do it. So I wanted to share that. And then I'm getting some responses about the question that was raised around budget. We do have people who have a budget allocated for staff satisfaction. That's great. There are committees within health centers. For example, someone shared that they have a moral committee and they have their own budget. There's some budgets for a kudo closet, employee engagement picnic and luncheons. That's great, and that's very common we see in health centers where they have some money. But again, that plan is so important because you have to think about, and people need to know, okay, guys, we're going to be doing an employee luncheon every 3 months or every 6 months, because that's realistically what we can do with our budget. But again, how do we prepare our managers and supervisors to come and play while we might have limited budget? How do we prepare our managers and leaders to be effective in their job, to always make sure that their staff feel valued? They're doing those simple notes like Patricia mentioned, you know, a letter or an email can go a long way. So there's a lot of strategies that have to kind of play together. It's not one thing alone, but staff need to know that you are invested in this. You want to have a culture of employee empowerment and improvement. This is how we're going to do it. They won't know what they don't know. I mean, it's up to everyone to communicate that and to embody that and to practice that. So I can't stress enough how important it is, the manager role in all of this. So thank you for your comments. I'm trying to cover as many as I can here because I think they're great. Some other people did say that there is no budget, and we see that quite a bit. But again, think about those simple things that you can do. We have to start somewhere. And if it's an employee suggestion box, that's great. That doesn't cost any money. But people need to know what you're doing with that suggestion and that idea. And I think that's where we get busy in our health centers. We're trying to prioritize, you know, something else comes up that is a demand. But as I mentioned earlier, you know, our staff, if we don't have staff, we can't do our job. We're not going to be able to provide the excellent care that we want to provide to our patients. And so we have just maybe a minute or two here.
Just highlight these are someone. Okay, so this next slide has no cost ideas for staff engagement. So I saw a question pop up that, you know, do incentives really work, you know, for retention? And so it's not always about money. And I think earlier on we talked about growth development or having a growth plan for each employee as you get to know them. You know, maybe their goal is to move into this other direction of leadership role or whatnot. So put them on a growth plan. That's not going to cost you anything. You know, you coach them. A lot of employees, that's what they want. They want opportunities to grow for the future, and that's how you retain them. So some other, so that goes right back to also onboarding right from the start. You know, a lot of health centers use e-learning systems for training, but how do you know they got it? And that's where training and coaching comes, you know, plays a part. You follow up, you know, you talk to them, you ensure that they got it, and then kind of help them improve in the areas that they need to improve. Plan, you know, develop a growth plan. So those are just a couple of little things that won't cost you any money that you can consider. Yeah.
Because of time here, I wanted to just go over to these resources that I wanted to share with you if you don't know about these resources. For those of you who may be struggling around how to do a survey, there's a couple of groups that I know of that are specifically working with health centers. The Crossroads group and, of course, NAC. If you all are members of NAC, the National Association of Community Health Centers, you want to check out this site. I have it here. They have partnered with an organization that does Staff Pulse, and they even have Exit Pulse. And it's a very affordable way that you can do staff satisfaction survey. They will do the analysis and the results and send you a report. They do an excellent job doing that. And what I like about it the most, and Crossroads does the same as well, is that you're able to compare how you're doing to other health centers in the country. So there's a data bank of other health centers. So it's great to look at what other health centers are doing in this area, and perhaps there's an opportunity for learning from your colleagues. And so if you don't know about NACPulse.com and Staff Pulse and Exit Pulse, I encourage you, because it is really, really affordable to do, and you can do it on an annual basis. And I just wanted for you to know that that's a resource and check them out, because I think that would help you if you want to start embarking on something, you know, for the first time. They would be a good resource. All right, well, we have ended the presentation for today, and we're about 4 minutes